what I've got going on is I've got restless leg syndrome. I'm exhausted, sore muscles, and I'm tired. And one other thing that happens with this is between 8 and 11 o'clock at night, if I'm driving home or I'm in bed, my leg feels like it's being torn apart. I've been on your classic, the Ultimate Classic, for about a month, taking two ounces for my body weight in the morning, and I'm still not getting any relief from it. So I'm thinking...
Okay, stop. What do you weigh?
I weigh 185.
Okay, well, the dose is correct, but the mistake you're making is don't take both ounces at breakfast. You want to split it up. Take an ounce at breakfast, an ounce at dinner. That's the classic. I'd split it up, so you're taking an ounce at breakfast, an ounce at dinner. And then, are you taking the EFAs, omega-3s?
No, I'm not. I don't have anything else.
Okay, well, listen up here. You can't take just a piece of the pie here. You got to take the whole program to make it work. And so what you want to do is take your 1 ounce of your Ultimate Classic, which is good at breakfast, 1 ounce of Ultimate Classic, which is good at dinner time. That'll be 2 quarts a month. I need you to take 6 of the EFAs a day, 3 at breakfast, 3 at dinner. That's one of the 180 count bottles per month. It has a certain amount of anti-inflammatory properties in of itself. Then I would like you to take the Osteo FX Plus. Take an ounce of that at breakfast, an ounce at dinner. That's 2 quarts a month. And then here comes the magic sauce, okay, to deal with the restless leg syndrome, which is a form of sciatica. And restless leg syndrome almost always occurs when you lie down or get into a lazy boy and kind of tilt back. Almost never occurs when you're sitting in a vertical hardback chair or standing up. And so it has to do with degenerative disc disease, particularly in the lumbar area. How much have you shrunk since you graduated high school?
I'm thinking 1.5 inches, an inch.
Again, 1 ounce of the Ultimate Classic at breakfast, again at dinner, that's 2 quarts a month. 1 ounce of the Osteo FX Plus at breakfast, 1 at dinner, that's 2 quarts a month. The EFAs, omega-3, 6s, and 9s, 3 at breakfast, 3 at dinner, that's 180 count bottle per month. And then the secret sauce here is the glucogel. I want you to take 15 glucogel a day. That's 5 at breakfast, 5 at lunch, 5 at dinner. That'll be 240 count bottles a month of the glucogel capsules. And this is to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue. Here we go, disc between the vertebrae. And the only negative side effect is you'll have to rehem your pants, because as you regrow that height you've lost, you will need to rehem your pants. And of course, as you support and promote maintenance repair of those discs in between the vertebrae, the pressure is relieved because the vertebrae are pushed apart, taking the pressure off of the motor roots of the sciatic nerve. The restless leg syndrome will go away. This whole system will deal with the exhaustion. It'll help you sleep better. And let me tell you, if you avoid all sugar and fried foods and processed meats with nitrates and nitrites, that'll go a long way towards you getting rid of this exhaustion thing you have. It can be a sugar problem. That's what I guess. It's a sugar problem. And stay away from sugar, natural and processed, no dried fruit, fresh fruit, no fruit juices. Stay away from fried foods of all kinds, no processed meats with nitrates or nitrites. That means absolutely no deli slices, no sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, and jerky, and absolutely no carbonated drinks and no alkaline waters during meals, an hour before, during, and after meals, because they will neutralize stomach acid and reduce the efficiency of absorption of minerals, reduce the efficiency of absorption of vitamin B12, and reduce the efficiency of digestion of proteins. And if you need some pain relief in the meantime, to apply to your back, your knees, your shoulders, your muscles, you can use the trauma oil from our Ancient Legacy division of our family of companies. Trauma oil, you can apply it as often as you need. And then you can also use our CM cream, which you can apply on top of the trauma oil. That's what I like to use when I bump myself around up on our farm. I will put trauma oil on first, and after 5 or 10 minutes, I'll put the CM cream on top of the trauma oil, and I get total discomfort and pain relief. usually within 5 or 10 minutes, and it will last anywhere from 5 to 8 hours. That kind of covers the neighborhood for you, Tad. And if you would, please, you have a classic series of problems going on. If you would call me every 2 weeks, give me an update, give me a progress report or a lack of progress report, because people want to hear what's going on. And if you would, please give us that report so we can pass on the information to our listeners, and they will know that you do not want to get surgery in your back. You do not want to get surgery in any of your joints, anywhere else in your body. Give me 90 days, but you got to do it right. Do not take entire doses at one time. You got to split things up, and you got to take the entire Mighty 90, not just the 90 or a piece of the 90. You can't take a piece of the 90. You can't take the Mighty 60 or the Mighty 30 or the Mighty 80. You got to take the Mighty 90 for it all to work. Okay, and her blood sugar level.